Welcome back to Chamber Exchange, brought to you by our sponsor, Bank Hometown and St. Vincent Hospital. Pleased to have with us Christopher Lauzon, who is a licensed social worker and Director of Business Development for the Hospital for Behavioral Medicine. Chris, welcome.
Thank you. Thank you for having me.
So maybe for our viewers, we could talk about what is the Hospital for Behavioral Medicine.
Yeah, so Hospital for Behavioral Medicine is a 120-bed treatment facility located in Worcester on the West Boylston line. Mm-hmm. It was founded in 2018. It opened in 2019. Yeah, so it's actually a partnership between US Health Vest, which is a company that owns 8 hospitals throughout the country, and also a partnership with UMass Memorial Health, which is a minority partner and provides us support.
Right. And, when you think about, we hear people read in the newspaper or hear in the news, the kind of the stresses that the healthcare system is facing. There's some hospitals, mm-hmm. Closing, some of the smaller community hospitals. We got others that are having financial difficulties. And UMass Memorial Healthcare System is our biggest employer in Worcester County. And so having kind of that relationship and affiliation is important. But in light of closings and things, you have opened to address and focus on what's a real need.
Yes, and surviving through the pandemic, we've stayed staffed up. We've continued to take folks in, hire. We're actually been operating close to capacity, so we're getting to the point where our efficiencies are such that we're treating folks, children to adults.
Right.
And originally, the partnership in UMass coming on board was to try and ease the strain to the system that provides support and treatment to adolescents and children. And so we actually have 2 units. So we have a 24 capacity of 24 bed inpatients in our inpatient adolescent and child unit. And we also have 4 other units. We have a women's unit, a dual diagnosis unit. We have a thought disordered unit, and we have a 55 plus unit. So
Chris, just like other elements of healthcare, I mean, there's the crisis situation, which oftentimes, are a St. Vincent or a UMass Memorial here locally, or a Harrington, or Clinton Hospital. They kind of deal with that kind of crisis situation. But then, mental health issues are no different than other elements of healthcare. Once that is stabilized, people still likely need help and assistance, but maybe not in that kind of acute care setting. Mm-hmm. I do think for the average person, the whole situation, you mentioned the pandemic, has really reinforced or brought a sense of greater awareness among not just young people, but people of all ages, the mental health issues and challenges, and mm-hmm. maybe people being more open to having and trying to address those. That's kind of the vision, or kind of the thought with the hospital and the partnership and the people and families you're working with.
Yeah, so those that require acute care oftentimes end up going to emergency rooms. The state actually has made a switch to also bolster what is community behavioral health and the community behavioral health clinics. So there's 30 throughout the state. That's meant in some ways to make mental health treatment more accessible, so that folks don't feel as though they have to go to an emergency room. First responders don't feel like they have to bring a person to an emergency room. They can connect them with those local supports, and we've done our best to stay connected and partner with those organizations so that we can decrease the barriers that are there and make treatment more accessible. We probably see 6 to 10 walk-ins a week that come into our facility, whether or not they're there for our outpatient programming, which isn't your typical outpatient programming. It's partial hospitalization, intensive outpatient for both adolescents and adults. So they could be coming in for that. They might be more acute, and they might be there to enter in our inpatient, which is 24/7, regardless of their presentation. But we've actually partnered with and we're contracted with Coastal, which is ambulatory transport, to assist us with a pilot with 2 of the local CBHCs, which are in Worcester. We're going to see how it goes. But to decrease the barriers. See, right now, it's if a person goes to a community behavioral health center, oftentimes if they are acute, 911 has to be called,
Right.
and they end up at the local emergency room, when we could just have them be a direct from community admission, which this pilot hopefully opens the doors and decreases those barriers and those boundaries.
So you're working with primary healthcare providers. You're working with, you mentioned, businesses, some of the regional hospitals. How are you getting the word out? And it sounds like, there are really anyone who has a need, you've hopefully got a way to work and serve with
Yeah.
them.
So it's about direct interaction, fostering and maintaining those relationships. Myself and a few other folks within the hospital are former emergency services directors, which is what originally most of these CBHCs were called, emergency service programs. And so now being more focused on the community, and a lot of the hospitals taking on their own internal clinical teams, we're all sort of in the same family. A lot of us have worked together in the past, and so I think understanding what is the need in order to have greater accessibility and having those previous professional relationships has really allowed us to foster what really should be no wrong door to getting mental health support.
Right. But in terms of the brick and mortar piece, I mean, is this kind of a new model?
Yeah, I think it's new in the sense that stigma sort of has been decreased. I think that's nationwide. Accessibility, certainly, the ability for folks to get telemedicine, especially through the pandemic and coming out of that. We've really, with that accessibility being there, all opened our eyes. Yeah, we're a brick and mortar facility, but like I said, we take walk-ins or direct from community admissions, and where we have an intake team that's available 24/7. And so any person can call on their own behalf. A provider could call on the behalf of an individual that was interested in services. No longer does a person need to go to an emergency room in order to get into, say, a 24/7 inpatient facility.
Right, and that getting that level of detail out, you're working with Mass Mental Health Council Association, the Worcester Business Journal Healthcare Forum you participated in, Mass Chapter of National Association of Social Workers, and then clearly that relationship with UMass Memorial Healthcare System is a way to get the word out.
Yeah, and we were just present at the Suicide Prevention Conference. We have sponsored events for the National Association for Social Workers, the Massachusetts Mental Health Counselors Association. We visited with all of the Reliant facilities to drop off pamphlets, all of the UMass primary care facilities. Really, we're just, it's boots on the ground, grassroots, trying to get the word out that, like I said, no longer does a person have to go to an emergency room to get support.
And appreciate your involvement and membership with the Chamber, because again, we talk with our members. Single biggest issue is workforce, and this is a challenge that not just people facing at home, but in the workforce as well.
Yeah, and that was a topic of conversation at the forum as well too. So I think, again, if we all work together, we can solve all of these issues and make care more accessible.
So Chris, if someone wanted to kind of go on more, learn about the Hospital for Behavioral Medicine and kind of the services, details, contacts, where can they go?
So it's a long name, but it's hospitalforbehavioralmedicine.com. We're on all of the platforms that are out there as well. So we're on LinkedIn. We're working on our Facebook page, but Instagram. And if they had any questions, they could reach out to me directly. If they wanted to make a referral for themselves or someone else, there's a direct line to our intake number, or to our intake team. That's 774-314-3490. They can also call the main desk at our 800 number, which is listed on the website, and they could ask to speak with a member of administration. But we're easily accessible.
So Hospital for Behavioral Medicine, all one word, .com.
Yep.
And all the information's there. So Christopher Lauzon, who's the licensed social worker and director of business development for the Hospital for Behavioral Medicine. Thanks for coming on and talking about a really important issue, but also an important asset for the Central Mass region.
Thank you. Thank you for having me.
Good. And stay with us. We're going to come back for our final segment.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.